Welcome to our latest episode of the Lebanese Physicians Podcast. And today, actually, I've invited Sarah Peterson, who used to be my immigration lawyer and has been heavily involved and actually led the American Immigration Lawyers Association before. So she has been heavily involved in advocacy for immigration issues for physicians and non-physicians alike. And today we will be discussing the new immigration laws that have happened under the new administration. Thank you for coming to the podcast, Sarah.
Thank you for having me.
As we start, or before we start the podcast, can you just tell us a bit about your background and what you're doing right now? I know you're based in Minneapolis, St. Paul at this point.
Yeah, so I am an employment-based immigration lawyer, and I've spent my career working with international medical graduates like yourself and this audience. I do a lot of advocacy work, so I've been involved, as you said, over the years. I go to DC a lot trying to enact smart immigration policies. I always say that I'm not effective because we haven't had any immigration policy change for about 30 years, but we keep trying. And yeah, so policy is my passion, and I also represent wonderful people like you. So
thank you. And yeah, I mean, I've worked, I've had you were a very good lawyer for me over the years. And one of the things I want to say is yes, we have not seen changes in immigration policy like by Congress and stuff like that, but we've had several or a number of executive orders recently signed in regards to immigration policy. And one of the big ones on them is potentially like stopping immigration. That's what people hear about, like for about, I think, 75 countries, right?
yeah.
Can you briefly explain what this new immigration policy actually does, or what is it in practical terms?
Yeah, and you're right. Congress is not doing anything, but this administration has enacted over 600 changes to the immigration laws just since last January, and it's really hard to keep track of what is going on. The 75 country pause actually doesn't really impact international medical graduates because that's really pausing people who are trying to go through the U.S. consulates abroad. And that's usually family-based cases, so it's not people here who are working. But what the administration also did is it took, I think we're all familiar with the travel ban, which impacted 40 countries. And what the Trump administration did then is it sort of spun off the travel ban. And it, in January, issued a memo saying that USCIS can't review or adjudicate any filings from anyone who was born in any of the 40 full travel ban countries. And so what that means is for anyone who's here, IMGs or anyone else who's going through the legal immigration process who was born in one of these countries, and it doesn't matter if you have dual citizenship, but if you're born in one of these 39 countries in the Palestinian Authority, you're just sitting there. And so we're talking about people who are trying to get work authorization cards, EAD cards, H-1Bs, O-1s, green cards, really anything. And the government was said that after 90 days, after implementing this policy, it would come back and update the public. And so on March 30th, it came back and said, basically not much. It didn't really lift the adjudication pause. And so we're really in this moment where people who happen to be born in these countries, they're just sitting there not doing anything. And then in addition, for these countries, the government is now issuing these, I sort of refer to them as show me you're a good person RFE, just saying that if you happen to be born in one of these 40 countries, that's just a negative factor for the government to consider. So we're really in this moment where the administration is looking at specific countries, really not doing any work on them. And so our legal immigration system is really tremendously impacted as well.
Yes, so basically what I've understood from you is the initial 5 countries are affected by, for example, getting immigration cards or green cards, but these are a lot of people like living outside the US. But from these 75 countries, some of them can still get a green card if they're working in the US. But there's 40 countries who are stuck in limbo right now. They have a visa, a working visa, but they cannot apply for immigration or for a green card at this point.
Well, they can apply, but they're just sitting there. And so most of them, their work authorization has lapsed. And so while they can stay in the country, they don't have the authorization to work. And so, for example, when I look at my client base, I've got a lot of physicians who are going through the J-1 waiver cycle. And we can talk about that if people don't really understand, but it's the process where physicians who have trained here have U.S. employers who are sponsoring them, going through the legal immigration system. They're getting to a certain point where, they should be transitioning from a J1 visa, which is their training visa, into an H1B, which is their work visa, but their case is just sitting at the Immigration Service. And so on July 1st, when their J1 status expires and the government is not approving their H1Bs, they're just sitting there. And what that really, translates into is you have a ton of communities across the country where employers are expecting these doctors to start. They've ramped up their patient charts and appointments, and these doctors can't go into these communities. And so I don't think that anyone is really understanding the impact that this is going to have come July 1st, but I think it's going to be pretty impactful.
So not only, I guess, are we pausing immigration like green cards, but they're also pausing, seems like, visas for these countries.
Any sort of benefit, any sort of legal immigration benefit, the government is just sitting on.
It's sitting on it.
Yeah.
Okay. Is that part of the executive order, or they're just sitting on it because it's a negative factor?
No, it's part of executive orders. This administration is doing both executive orders and proclamations, and it's hard to keep track of them, but they're essentially the same thing in terms of impact.
And one thing I think people need to know is like a lot of the IMGs, or international medical graduates, who are not green card holders or citizens, actually are on J1 visa. And the J1 visa physicians tend to work in underserved areas where there's a lack of physicians in the US. So when you impact a lot of these countries, that means you're impacting a lot of the smaller hospitals and smaller regions in the US in that case.
Exactly. Yep.
And so basically, what can these physicians do at this point if they're going to start in July? What's going to happen to them? People who are finishing their fellowships, what's going to happen to them come July?
I mean, they can't work. Some of them, there's a few active class action suits that are pending. I know a few physicians are now starting to hire lawyers to litigate, but it's yet to be seen if any of these cases are going to actually get adjudicated and make their way through the system.
Okay, so now we talked about J1s, which I think is pretty obvious. If you can't convert it to an H1, you can't work. But let's say you have somebody who's already started their waiver, they're an H1B visa holder, and whether it's a physician, I guess, or tech worker or other industries, what's going to happen to them? Because the H1B visa also has a limited cycle, right?
Right. And so presumably these people are going through the green card process, and once they get to a certain point, if they're eligible to file for their green card, they can file, but their cases are not being approved. And then when you go one step further, if you have people who are trying to naturalize, which is to become a U.S. citizen, it's the same thing. The government is just sitting on the cases for these individuals from the 40 countries.
Wow. So even if you're a green card holder, you've reached the point where you can naturalize to become a U.S. citizen, you cannot become a U.S. citizen right now.
No.
My God.
If you're born in one of these countries, yeah.
Yeah. That is, I mean, I think this stuff is underreported. Like, people don't read into it as much, I think, at this point.
Well, it's super confusing. Even someone like me who's been practicing for 20 years, it's hard for me to keep straight all the different proclamations and the impact. But I think this one, like I said, I think it's misunderstood, not understood. And I think the impact, particularly on healthcare, is going to be really devastating come July 1st.
Yep. And what about, I mean, H1Bs too, like in 6 years, right? They can't renew it anymore. So they might reach a point too where they cannot renew their H1B visa anymore, and they're going to be out of status, right?
Well, I think I mean, potentially, yeah. And our hope is that the government will just lift this. I know that there's a lot of congressional offices starting to look at this now because they're starting to understand the impact moving forward. Yeah. But yeah.
Yeah. What about O1 visa holder? And for people who don't know, O1 is like an outstanding visa, because these people too have to renew their visas on a regular basis, right?
Yeah.
So what's going to happen when their initial visa, let's say, runs out? Can they renew it?
They can file it, which preserves their right to stay in the country, but again, they can't work. I have clients in that situation as well. And, a lot of my clients are dual nationals, and so that doesn't even save them.
Yeah, so even if let's say you're a Canadian citizen and a Yemeni citizen,
or Syrian, or
Syrian,
Iranian,
Syrian, Iranian,
yeah.
You cannot, they take your citizenship that's high risk, what they quote unquote high risk, and you cannot apply.
Yeah.
And that's, And so, and again, when the O1 physicians, I mean, a lot of them are outstanding, right? This is an outstanding visa. So basically, these are highly skilled physicians. So why are we considering now even highly skilled physicians who have been given O1 visas like high risk for the country?
I mean, it's interesting. If you read the proclamation, the administration goes through different factors like overstay rates, inability to really vet these people, even though the US government, we go through multiple different international databases and have a really robust vetting system. But they ultimately go through each of the 40 countries and list specific reasons why we can't adjudicate these benefits, which is fascinating because if you think about it, if there is a real legitimate concern about risk or safety or crimes or whatever, why are these people just here? Like why are we letting them just stay here in this like indefinite hold? So
Right.
it's an interesting sort of position the administration is taking.
Yeah, what you're saying is like if they're high risk, how did they get into the country in the first place?
Correct. Yeah. And why are we letting them just stay here?
So
So
saying that, I mean, you said that some of them are going through legal pathways. Do you think there are like legal pathways that they can fight this at this point?
it'll be interesting. I think we're just starting to see litigation ramp up. I'm not a litigator, so I can't make any predictions in terms of whether these cases will be successful. But I think the more that this is put into the public eye, I'm hoping more congressional offices will take notice and that hopefully litigation, once the judge sees what's going on for the same reasons we've been talking about, a judge will be like, well, make a decision one way or another. Don't just hold these cases, in perpetual, just without doing anything.
Right, right. And just for people to know the impact of this, so what's the percentage of physicians in the US who are international medical graduates?
So overall, international medical graduates are about 25% of the workforce. I have literally no idea how many are coming from the POGS countries, but overall, it's a significant amount.
Yeah, it's a very large amount of the workforce, and we know that there's a physician shortage in the U.S., especially in the underserved areas where these physicians work. So let's say I don't know if you have data on this, but let's say in the underserved areas in the U.S., what percentage of these physicians in these areas are it's probably higher than 25% that you have international medical graduates, right?
Yeah, I don't think that we have good data in rural areas, but if you look at underserved communities, whether they're urban or rural, the data suggests that international medical graduates, they stay there longer, they build roots in their community. So it's a compelling argument that the programs are working and really trying to integrate international medical graduates into underserved communities. It's working.
So what do you think is, I mean, I can say it too with you, but what do you think would the impact be in these areas of physicians losing their jobs come July or not being able to make it to their jobs come July?
The impact?
Yeah,
I mean, access to healthcare across the
right,
country,
right,
right?
right,
Like
right.
you have, like I said, we have employers who have built the schedules out. We have patients who are waiting to receive care. And when that doesn't happen, that just exasperates their medical conditions. It has impacts on, when you're looking at rural health, you look at the data in terms of hospitals closing. There's just so many impacts that I don't think people are actually kind of working their way through. And it's gonna become pretty obvious pretty soon.
Right. And especially I think with some of the Medicaid cuts that are happening at this point, there's going to be
Absolutely.
multiple factors that are going to lead to the effects on healthcare in these areas. So one thing is you had an article on that was published recently on discussions with like a number of physicians who are in this limbo right now. Can you give us, I mean, I know these people have talked about it in like in an article or in a journal. So can you give us some like specific examples of physicians who have been impacted by this?
Yeah, I mean, and I'm not remembering that article specifically, but I can tell you about some of my clients.
Yeah.
I just spoke to a resident a few days ago. He's an internist. He just did his first year because he was a student, and so he got 1 year of work authorization thereafter. And he just is getting close to finishing his 1 year. The program filed a change to H-1B status, which permits him to work for the remaining second and third year of training. But it's just sitting there because even though he's a Canadian and Iranian citizen, but with dual national, he's subjected to that benefits pause. And so he's really trying to figure out what does he do. The residency program is in a jam because they need him. He's in a jam because how long will the residency program actually hold open his spot before trying to fill it with someone else? So that's just one example. And I could, go on and on with the various, I have an Iranian doctor who is going into a rural area. She is really worried, and for the right reasons, because, everything that's going on in the world. And, she's gone through the J-1 waiver process. Again, the employer has filed a change of status for her to work in H-1B status, but she can't, it's just sitting there. And for Iranian citizens, there are also residual effects in terms of bank accounts get pulled, because if you can't show legal status, no bank wants to work with you because of the international laws with Iran. And then, driver's license get impacted. And so there's all of these real world impacts of, these international medical graduates who we, the United States of America, has trained with Medicaid money, and we have communities that need them, employers who have sponsored them, and they're just sitting there.
Yeah, because potentially some of these physicians might actually go work in different countries, and then it's going to be hard to get them back because they're going to be established in some other countries that potentially also need them, and
Right.
not come back to the US, even though they were trained in the US. So the US healthcare system has spent a lot of money training them, because people don't know that Medicare actually pays for a lot of these residency programs.
Right. The vast majority of them. So, yeah.
Yep. From your perspective, is this policy aligned with, I mean, you're going to say no, with the national interest, especially in healthcare?
Well, I find that to be an interesting conversation, because we have programs that Congress has enacted that actually find the physicians who work in underserved communities is precisely in the national interest. It's a pathway to a green card. And for these doctors, they actually have to get letters confirming that their work is in, it's called the public interest, but it really is U.S. national interest. And so if you've got the U.S. Congress creating immigration pathways for green cards for these specific physicians, I think smart immigration policies suggest that we should not be having these pauses.
Right, exactly. Because also these scare people. I mean, some people might say, I'm going to go train in Australia or in the UK or in other places because I don't know what's going to happen. Like, if everything's going to change every year or every 2 years, I'm not going to take a risk.
Yeah, and I think I was actually looking around a little bit before the podcast, and there's some really interesting research that's being done about the global migration of doctors. And, the biggest, it's been done by the Organization for Economic Cooperation and Development, the OECD. And so that's a 38-member organization, but they're just looking at how doctors are flowing across the globe and what countries are high users of international medical graduates. And as of 2023, the US, United Kingdom, and Germany were the top users. But I think what that means for us is that, I have clients who at the end of the first Trump administration left or were very seriously considering leaving and going to other countries because they wanted a system that was predictable and stable. Because if you're going to spend this much time training, you want to be able to be, have some level of guarantee that you can stay and it'll be safe for you and your children, right? And so I don't think we have started, I haven't seen it in my practice yet where people are talking about leaving, but we're only, a year into this kind of super unstable immigration system. And when there's other countries like Germany and the UK that seem to, be a lot more stable, I think that's probably where this goes.
Right, exactly. And I think, again, and the people don't know is also actually when you're an IMG too, you have to do your sit for USMLEs, come and do electives. So also before you start training, you're spending a lot of money to be able to get there and be able to train in the US. So it's not an easy process for you to get privileges to be able to train in the US. So, and we talked about the reverse brain drain, I guess, at this point. So what do you think? What's the AMA? And because the AMA should be heavily involved lobbying for this, and what is ILA doing to try to reverse this process?
Yeah, so and one thing that I haven't talked about yet is, in addition to this, the pausing of benefits, the Trump administration enacted this new $100,000 fee for new H-1B petitions. So you heard me right, $100,000 for each person, and it impacts any new H-1B petition. So that means any IMG who is, let's just say in, Canada, for example, and they need an H-1B petition, the government needs to pay $100,000, or not the government, the employer has to pay, in addition to all the other fees that are normal and have existed forever, $100,000. The first announcement from the Trump administration put up exceptions, national interest exceptions. They provided for industry-wide, company-wide, or individual-wide exceptions, but to date, no one has been granted an exception. And then their criteria was more refined, and it made it, very clear that they were only going to grant these national interest exceptions for extraordinarily rare circumstances, and then they list a variety of different things that you have to show. And so going back to the AMA has been very active to try to get the healthcare organization or the healthcare industry as a whole exempt from this new $100,000 fee. Because I have clients who heavily recruit because there's just not enough U.S. medical students to fill all of the residency and fellowship slots in the United States. And so a lot of their programs are being filled by international medical graduates. And there's been really real conversations within academic medicine of, can we pay this $100,000 fee? What does it do to our endowments? Like, how do we buckle up because we need these people? And that's wild.
Yeah, exactly. I mean, $100,000 fee, and I think per year, right? It's an annual fee.
Well, it's every H-1B petition. So yeah.
Okay, so every petition is like $100,000. So it's like it's a massive amount of money, especially if you're recruiting somebody for a residency program.
Yeah. And it's interesting. The USCIS funding has actually gone down since they implemented it, which just shows that instead of making money, like I think they thought that they were going to, they're losing money. And in fact, I think there's been like 85 people, this has come out through litigation. There's been 85 employers who have paid this fee. Most of them are international medical graduates, which if you think about like the healthcare system and funding or lack of funding, that's the least viable employers to be paying that $100,000 fee.
Right, exactly. I mean, it's like and the reason they paid it probably is because they really need it. Like they're like desperate, and they said we're going to pay it.
Yeah, exactly.
So, what do you think hospitals are doing at this point? What are hospitals doing to potentially mitigate this, or are they doing anything?
I think everyone's trying to figure out how to maneuver this moment, right? I think there's a lot of fear and there's a lot of desire to not make noise, and just to stay under the radar. You are seeing leaders start to speak out, to reach out to their congressional offices, to try to prompt Congress to do things. And frankly, I think that's all they can do. In the first Trump administration, you saw a lot more appetite to actually litigate. Under the second administration, there's not much appetite by employers to actually litigate these issues. So I think the only viable thing that hospitals and healthcare systems can do is really try to engage with Congress and get Congress to actually try to do something to, reverse some of these policies.
Yep, exactly. And because I think some of the employers are also worried about like repercussions if they tend to litigate at this point. So now I'm going to ask you some rapid questions. What is one myth about immigration and physicians that you would want to debunk?
I love this question. So IMGs are not taking jobs away from U.S. workers. We are simply, as a country, not educating enough or providing enough training programs for U.S. medical students. And so IMGs really fill this critical need in the United States healthcare system, and they're not taking jobs away from American doctors.
American doctors, yeah, that's very important to know. What one policy change that would make the biggest impact immediately?
Lifting the benefits pause that we talked about and the $100,000 fee. I know that's two, but I think we need them both.
Yeah, exactly, $100,000 fee. In one sentence, who is the most affected by the policy, the doctors, the patients, or the hospitals?
And unfortunately, all of them. U.S. trained doctors can't work. Patients don't get the doctors and the care that they need, and hospitals are losing talent. So,
yeah. Sarah, thank you so much for taking some time and being on this podcast. And thank you for all the advocacy that you do especially, I think you've worked with physicians for a long time, especially for international medical graduates and helping physicians potentially be able to stay and work in the US. So hopefully this policy will change soon, as soon as possible.
Thank you for having me on and letting me shed some light on what's going on. I appreciate it.
Thank you.
Thanks.